We watched another episode of this show before, but it's time to check out another episode of Body Bazaar. Let's get started. Bee-woo!
56-year-old fisherman and father of two, Alejandro Ramos, goes by the name Willie. 4 years ago, Willie suffered a horrifying accident that mysteriously transformed his body.
I kept swelling. My arms grew to an incredible size. It didn't go down.
He almost has the phenotype, the body type of someone who injects synthol, which is an artificial oil made to enlarge your muscles. But it's almost like not in his muscles.
I was working at a depth of around 115 feet. A cargo ship was coming. It went over my air hose and cut my air hose in two. I knew I had to surface fast. I couldn't stay any longer. I let go of my lead belt and got pushed up like a bullet. I started to lose all of my senses. I opened my eyes. Everything was blurry.
So the neurologic findings that he's experiencing is basically like diver's disease or BENS, where basically nitrogen bubbles, part of the inert gases that you inhale every time you take a breath, start bubbling up. If you inhale those gases at a depth of 100 feet, those gases are inhaled at a higher pressure. Therefore, when you go into a lower pressure environment, those gases start bubbling up. And imagine your blood starting to bubble, it causes serious problems. Usually in the neurologic system and your joints.
Willie's chest and arms ballooned, leaving his torso swollen and deformed.
This is a very, very severe form of it. Like, usually it's mild and usually it is treatable with 100% oxygen treatment, usually in a hyperbaric chamber.
Using a hyperbaric chamber, doctors treat sufferers by having them breathe oxygen in this pressurized vessel.
I've seen patients who've had subaquatic illnesses and arrived completely swollen. But with the hyperbaric chamber, these have disappeared in 1 to 3 hours.
Yeah, so he must have had more severe damage to his blood vessels as a result of that swelling where it seems to have become permanent. And you know, when you damage blood vessels and they become more permeable, they could start to leak. When those blood vessels start to leak, it could actually create edema in the surrounding structures, which is what he could be having. It's very similar to what happens when you have age-related, gravity-related swelling in your lower extremities, in your legs. So like you stand all day, you're age 60, your veins aren't as spry anymore, so they're a little bit more swollen. Blood starts to pool there throughout the day, and as a result, they become more permeable, more edema comes out, and as a result, you have thicker ankles at the end of a long day, which is why we recommend to pick your ankles up, to wear supportive compression stockings, etc., etc.
Willie has had multiple sessions in a hyperbaric chamber. Sadly, he has not returned to his normal size. As a result, Dr. Aguado decided to draw blood and take tissue samples from Willie to solve the mystery.
I wonder what part of the body he's actually taking samples from. Is it from the blood vessel, the muscle, the adipose fat tissue?
A month later, Dr. Aguado confirms that Willie's condition was due to nitrogen being lodged in his fatty tissue. The next medical step will be reconstructive and cosmetic surgery to remove the fatty deposits.
How in the world do they need that test in order to say like, oh, get cosmetic surgery and we'll fix it? I'm pretty sure that would have been anyone's recommendation, whether or not they knew it was from the nitrogen bubbles.
Juliana was born with congenital melanocytic nevus, a rare genetic skin condition that causes an overproduction of skin pigmentation cells.
And it not only produces melanin a lot, it produces melanin a lot in specific areas. So as you can tell, it's not her entire skin color, it's just sporadic.
Her birthmarks and dark patches of skin also made Juliana sad and self-conscious.
That's very understandable. If you're born and you look different than everyone else around you, especially as a child, it's easy to get bullied and then feel like you're ostracized from your own peers.
Juliana now posts photos of herself on social media to promote awareness of the issues faced by people with skin conditions.
I think that's great in order to highlight that humans come in all different shapes, sizes, colors, and just because her appearance outwardly looks different, it shouldn't stop her from living a full life. And it shouldn't stop you from interacting with someone like this.
1 out of 10 people with congenital melanocytic nevus will develop skin cancer.
So basically, when you have a type of birthmark pop up like that, essentially you're having micro mutations in those areas because you're having excess production. When you're having excess production, that puts you at higher risk for cancerous production.
If I will stay at the sun for a long time, every of my small birthmarks also can change to melanoma, and it's really risk. So that's why I need to go and check them.
The way that we check them is through a classification system known as A, B, C, D, E. Each one represents a specific criteria that we look at. A, asymmetry, B, the borders, C, the color, D, the depth, and E is evolving. Basically how it changes over time. That's why if you ever have a mole or birthmark that has changed, that's a good reason for you to go see the doctor. And this allows us to understand what risk each of those birthmarks poses to the individual. If some of them are suspicious, we do send them through a biopsy to pathology to figure out if they're cancerous.
Dr. Witkowski uses cutting-edge digital dermoscopy equipment to photograph all of Juliana's birthmarks, capturing their exact positions and sizes so they can be monitored for any changes.
In her condition, it's a lot harder to gauge changes because there are so many of these birthmarks. And also, like, look, if I have 2 small birthmarks on my legs and one of them happens to change and we're concerned, we can easily take that small biopsy. But imagine she has many of them. If she can't like biopsy her entire skin layer, so for her, it's best to do this through a non-invasive method and be strict with it like a camera.
This lesion is the only one on your body, but it is different from the rest, and it's a good idea to remove the lesion just for your own safety, and then we'll assess it with histopathology.
So histopathology is they'll basically take a slice of it, look it under a microscope, and then if they do in fact see a cancer, you might have to go for excision with wider margins. When we say things like margins, what we're actually saying is that we want to make sure that at the borders of the area that you've biopsied, there's no residual cancer, which means that you got the entire cancer.
Jolison's astonishing height of 7'9" makes him the tallest man in Brazil.
Oh, wow.
3 years ago, Jolison met Ivem. They weren't exactly a perfect match. Ivem is just 5 feet tall.
Maybe that is a perfect match. Perfect match doesn't mean they have to be the same height.
But there was an instant attraction,
I'm instantly attracted to that little goat thing that they have. Is that a goat or a puppy?
and the two were married within a year.
I love that the cake decor is true to size, at least true to proportion.
The couple is concerned
From something within his sex cells, or is it his partner's?
Your spermogram test doesn't show the presence of sperm.
the excessive amount of hormones that triggers gigantism can lead to a reduction in other hormones, such as testosterone. This has led to Jolison having underdeveloped testicles.
This should have also been elucidated on the physical exam. That should have been part of all of this workup. I'm surprised that it took them finding this out on a test as opposed to a physical exam. And I wonder if this condition would be correctable by giving him hormone supplementation.
The couple is now making plans to move forward with adoption to complete their family.
Oh, that's not a goat. That's a puppy the whole time. It looked kind of goaty to me.
On the outskirts of the city, there's a boy living with a unique condition, 11-year-old Li Hang. Li Hang now weighs more than 300 pounds. He suffers from a rare genetic disorder called Prader-Willi syndrome.
Prader-Willi. You know, this is interesting because this condition is not something I've ever seen in my patients, but it is something that is frequently tested in medical school and on medical boards. Where it's a congenital syndrome, where it's a chromosomal issue. More specifically, it not only affects hunger, but also cognitive impairment, sleep impairments, many other factors in the development throughout a child's life.
There's no known cure for Prader-Willi syndrome, which can also cause a number of physical, mental, and behavioral problems.
His large size would put him at higher risk for development of early onset, even osteoarthritis, joint disease.
In a desperate attempt to help him lose weight, Li Hang's parents are taking him to a hospital that practices traditional Chinese medicine designed to help people battling obesity.
He has a disorder in the feeding and satiety centers in the hypothalamus, located in the brain.
This is true, but it's a genetic issue, so it's at the core of his cells.
The medical treatments here are unorthodox, but doctors are licensed medical specialists, and the hospital claims a high rate of success.
We will use traditional acupuncture, fire therapy, and fire cupping.
This is where I kind of start getting disconnected from the adjunctive therapies like acupuncture, where we're talking about it for musculoskeletal uses, for pain uses, where there seemed to be some evidence, and then we start moving it to just general well-being or obscure cases like this, where you're saying that needles can impact the neurological structure and the genetic structure of someone's brain. That seems to be a little bit too far out for me to say that it matches some level of evidence-based medicine.
Fire therapy with Chinese medicine is where we incorporate extracts of herbal medicine that help speed up metabolism. We light up the medicine with fire. It is especially helpful for patients with abdominal obesity.
Finally, Li Hang is given a round of fire cupping treatment.
I don't even know what that fire therapy is. I'm not gonna lie, it seems very non-evidence-based. And again, cupping in general has very weak evidence for it, but then for myofascial tightness, for restrictions, again, musculoskeletal conditions, I could see it being valuable. But for someone who has a hunger issue from a genetic condition, it seems a little ridiculous to treat it with this.
But the doctor points out that these traditional remedies can only work if Li Hang is able to stop his excessive eating.
If he stops his excessive eating, he will lose weight without those treatments. Like, that's the core of the situation. So I find it ridiculous that they're saying that.
There's no foolproof scientific evidence these procedures are effective.
This is where patients in situations like this are often misled because they're just searching for any type of cure. Where science doesn't have an answer, pseudoscience and misinformation tends to thrive.
Mark may appear healthy, but he actually suffers from one of the world's rarest disorders.
Why is he looking at the waters so angrily? I'm sure it has something to do with water.
I have to drink 20 liters water a day to stay alive. I can last without water 1.5 up to 2 hours.
I wonder if this is a form of diabetes insipidus where he actually is either lacking or not responding to a specific hormone that prevents fluid loss, excessive fluid loss through your urine. This is actually an important hormone that your pituitary gland stores and your hypothalamus creates in order for you to be able to balance the amount of water in your system. And that's a very tightly controlled balance.
I will get very high fever and dizziness, can't remember things, and I do not know in extreme where I am and who I am.
It essentially becomes a form of dehydration.
Mark suffers from the rare disorder known as renal diabetes insipidus, or nephrogenic diabetes insipidus.
The difference between that and like the cranial version of it is that the cranial version is your body doesn't produce the hormone, and in renal or nephrogenic is, for some reason, it's not responsive to the hormone.
I wake up in the night and then I go to the toilet and go back and sleep again. So you can say, okay, maybe it's 20 times a day.
It's important that we point out this has nothing to do with diabetes mellitus, which is a sugar control condition, whereas this is a water retention excretion condition or a water balance condition.
Mark's condition is very interesting. It's a very rare condition. Unfortunately, we do not have a very good treatment for those patients. Not to say we cannot cure it, but we not even have a reasonable treatment for those patients. So what can I do for you today?
I love that the scene goes from him saying, we have no reasonable treatment, we have no cure, but what can I do for you today?
My GP
in
Bielefeld told me that diuretics could be useful for me.
I believe thiazide class of diuretics can sometimes be useful here.
Diuretics normally treat high blood pressure.
Well, not only high blood pressure, there are several indications for what we use diuretics for.
Less salt in the body could reduce the urge to urinate. It's an experimental approach, but Mark has nothing to lose.
And there's different classes of diuretics. There's like loop diuretics, which the most common one that we talk about is Lasix, thiazide type diuretics that are more commonly used for blood pressure control, like chlorthalidone or hydrochlorothiazide.
After a few weeks, the diuretics seem to be working. Mark doesn't wake up in the night to go to the bathroom quite as often. He's less tired and he has more energy. to pursue a very active lifestyle.
Always great to see some treatments working. And I think that there's definitely progress to be made in these conditions. Check out the absolute worst medical takes on Twitter. Worth reading. Elon Musk is mentioned a couple times in this one. As always, stay happy and healthy.